High blood pressure is a condition that puts you at risk for heart attack, stroke, and kidney disease. It does not usually cause symptoms, but it can be serious. When your doctor or nurse tells you your blood pressure, he or she will say two numbers. For instance, your doctor or nurse might say that your blood pressure is 130/80. The top number is the pressure inside your arteries when your heart is contracting. This is called systolic blood pressure. The bottom number is the pressure inside your arteries when your heart is relaxed. This is called diastolic blood pressure. Normal blood pressure is less than 120/80. Elevated blood pressure is 120/129/less than 80. Stage 1 hypertension is 130/139/80-89, and Stage 2 hypertension is at least 140/at least 90. Most adults with hypertension have primary hypertension, also called essential hypertension. This means that the cause of high blood pressure is not known. A small subset of adults has secondary hypertension. This means that there is an underlying and potentially correctable cause, usually a kidney or hormonal disorder. It is a good idea to get a home blood pressure meter. People who check their own blood pressure at home do better at keeping it low and can sometimes even reduce the amount of medicine they take. How do you check your blood pressure at home? Once you get a home blood pressure meter, your doctor or nurse should check it to make sure it fits you and works correctly. When it's time to check your blood pressure, sit in a chair with your feet flat on the ground for at least 5 minutes. Do not smoke or exercise for half an hour before checking your blood pressure. Try to breathe normally and stay calm. Attach the cuff to your arm. The cuff should be tight enough not to slip down, but not uncomfortably tight. Follow the directions that came with your device to start measuring your blood pressure. White coat hypertension is defined as blood pressure that is consistently elevated by office readings but does not meet the diagnostic criteria for hypertension based upon home readings. Treating high blood pressure can reduce your risk of heart attack, stroke, and death. Treatment of hypertension usually begins with lifestyle changes. Recommended changes often include reducing the amount of salt in your diet, losing weight if you're overweight through exercise and a healthier diet with lots of fruits and vegetables, avoiding drinking too much alcohol, and stopping smoking. Exercise for at least 30 minutes per day most days of the week. A medicine to lower blood pressure may be recommended if your blood pressure is consistently high, usually at or above 140/90. A high blood pressure emergency is a serious and even life-threatening condition that can happen when a person's blood pressure gets much higher than normal. When a person's blood pressure gets very high, it can lead to problems in one or more of the following organs: the eyes, the brain, the kidneys, and the heart. When people have high blood pressure emergency, their blood pressure is usually 180/120 or higher. The symptoms depend on the organ or organs affected. They include blurry vision or other vision changes, headaches, nausea or vomiting, confusion, passing out or seizures, weakness or numbness on one side of the body or in one arm or leg, difficulty walking, trouble breathing, chest pain, pain in the upper back or between the shoulders, brown or bloody urine, pain in the lower back or the side of the body. Thank you for listening. If you like this video, please click the like button, hit subscribe, and ring the bell. Be healthier.